Wake, the president of the League of Women Voters of Virginia. We're so happy to have you with us here as we speed toward crossover. With us this morning is Emily Griffey. She's the Chief Policy Officer at Voices for Virginia's Children. Welcome, Emily.
Thank you. Thank you for having me here today. It's fun to be here to see you on the big screen Zoom and the little screen here. I'm downtown in the Tidewater room. So introduction to me and Voices and some of the issues that we're focused on this year around children and families in particular. I think many of you have been familiar with Voices and some of our work over the years around raising children's issues during election cycles. And I know we've connected with several of you that are on different committees for the League of Women Voters about childcare and the like. But Voices is a multi-issue child advocacy organization. So we look at the whole child and sort of how they can grow and thrive in the context of families and communities. And so for us, that means focusing on early childhood education, family economic security, access to healthcare, mental health, and the foster care system as well. So we touch on a number of issues, and over the years have really enjoyed having bipartisan support for children's issues because there are often many folks on both sides of the aisle who see the importance of these issues and working across various programs and agencies to help kids and families. I will say over the last year, it has been kind of a different, I can put it in the chat maybe, a different environment with children's issues. We've seen kids and their health and safety become more politicized, I think, over the last year than we have in terms of my experience in working in these issues. And that does come with, I think, a new environment and context for us to think about how we advocate for kids and families and to ensure some progress moving forward for, in particular, when we have this divided government between the House and Senate, divided control of government. So that is something that we're sort of keenly interested in and sort of interested in hearing from you all about in your communities, what the feel and flavor is for advocating for children and families in light of this new, more politicized environment. But some of the key things that we are watching, as we're getting to crossover, we have some issues that have already fallen off and died. But in terms, one of those is in terms of healthcare access, a bill to cover all kids carried by Senator McClellan and Delegate Tran would have provided health insurance to undocumented or to immigrant children in the state. And that would have been a new state-funded program to provide that health insurance. Virginia ranks 25th in terms of the number of states that provide health insurance and insure all kids, which is kind of lower performance than a lot of other areas of our health and wellness access. So we would like to get more kids covered. This was the first time proposing this initiative, having a bill for it. The cost of it is kind of expensive because we don't get to pull down the Medicaid match for it. Thanks for dropping the bill number 1012, and I think McClellan's 484 on the Senate side. So unfortunately, both of those bills died, but it did have a fairly strong appetite to continue the conversation into the future. So we think this is the first time to explore this idea about health insurance for immigrant children across the state, and we'll see this in the next cycles of the legislative session to come. And so that one would have had a lot of impact on a specific number of children. Other bills that we are looking at are really about better economic security for families, which we know has been incredibly challenging during the pandemic, and that the disruptions that have come to families' lives have been really impactful. So one of the things that we've been advocating for is a refundable version of the earned income tax credit, which has been proposed for a few years, but really has the best opportunity out of the gate this time. It's included in Governor Northam's introduced budget. There's a bill in the Senate that has been reported from the subcommittee. It hasn't yet been heard in the full. I don't remember the bill number. It's Senator Barker's bill, refundable tax credit. So we do think that it's going to have legs for crossover and be a part of the negotiation and conversation moving forward, whether that refundable portion of the earned income tax credit can be then targeted to working families. And it's about, I think it's about 700,000 families or 700,000 tax filers in Virginia, and 72% of those are families who would benefit from the refundable earned income tax credit. That wouldn't take place until the next year of filing taxes in 2023 because of getting that program up and running. So it would be another year. There's another conversation on the table around one-time tax credit payments that have been sort of a state version of what has been offered in terms of the federal stimulus checks or the federal child tax credit. That one-time payment was also in Northam's proposed budget and proposed by Governor Youngkin as well with the current year's fund. So it would be something that would go, families would receive sometime between July and November of this year. We would like to see currently the one-time payment is targeted to single households or married households. And that's the only criteria. There's no income criteria. There's no consideration for family size or anything to really make that payment equitable or even equal among people. So we are hoping to craft some proposals to make that more of a family or parent payment for one-time relief, since we know that children and families have been struggling during this time. Our federal child tax credit has not moved forward at this point. And so we'd like to see more equitable distribution of those tax resources with that one-time payment. And so hoping that might come into this conversation as we get into the final stage of the budget negotiation in those last few weeks of session. And then the other piece that we've been really lifting up is around children's mental health. And that's another thing that has been, really brought to light in the pandemic, and our lack of resources to be able to serve children's mental health needs in community-based settings, in clinical settings, in schools. And really, we need both the workforce for this, the reimbursement rates to ensure that providers are getting paid adequately for these services so that they will offer these services for children's mental health, and the integration in different settings where kids have their day-to-day lives so that they can get access to these mental health services. And so we have a lot of things we would like to see accomplished. Other stuff lots of things we'd like to get accomplished around children's mental health, and Delegate Watts just has been a great supporter on all of those issues. But one of the things that we would like to see is a new pilot program to link our Department of Behavioral Health and Education and the Department of Education to provide clinical services in schools, or for schools to contract or purchase clinical services in their community, so that they're not then searching for a place to send children that may need to be screened or diagnosed or treated, and they can have a better connection. We've seen schools operate that way through ARPA resources, and realizing when they were getting additional funding through ARPA that they needed this kind of connection and support. So we would like to see the state continue that effort. ARPA, the federal American Rescue Plan funds. So I'd be happy to answer any questions. I see Jan, somebody raised their hand. Maybe they unraised it.
Usually we put it in the chat.
Oh, in the chat. Okay.
And Joan can read these off.
Okay.
I don't see any right now in chat, and I apologize. I'm getting notices that my internet is unstable. So if I sound like a Martian, I'm sorry.
Here's some.
Anyone have any questions for Emily? Please drop them into chat. I had a private question about the budget process. Someone sent me, so what's, you said there are certain things that you have to have in the budget process. That's a different process than the regular legislation. Someone's wondering if you could explain that a little bit.
Yes, so I can talk about that a little bit. So typically what happens is the House and the Senate each report a version of the budget. It's based on which bills pass, as well as budget amendments that are proposed by the House and the Senate. So when it comes to the budget report out crossover, which this year is February 20th, they have different versions of the House and Senate budget, and then they form a committee of conference committee negotiators that hash out the details. So oftentimes they will be in different places on, particularly in divided government, different places on big issues around taxes and revenues or how much to spend on education, and they have to negotiate some of those differences. They don't do it in a bill hearing, they do it in conference committee negotiations. So it is a different process there.
I got a private question also about the behavioral health bills. Someone missed sort of, where's the status of those?
Yeah, so those are the most of what we've requested around children's mental health is budget amendments, because this would be, rather than, we didn't need to get a bill to get some of these things going. We wanted to pilot a project through the Department of Behavioral Health. So it's a budget amendment. Senator McClellan has it on the Senate side. Delegate Price has it on the House side. And that would be then something that would get added to the budget in this amendment process. And I'm seeing a question, if there are no clinical, no clinical services in the school system, if clinical services are needed, who pays? Is it only available if the parent's insurance pays? So that is a tricky question, and I am not a full-on insurance expert, but certainly depending on the how you have coverage or where you seek care could depend on who pays. So if you are seeking clinical services and you are insured privately, then depending on the coverage of your private insurance might depend on what mental health services you get. And I know there are some issues with the coverage options for private insurance, that it doesn't require coverage for all types of mental health services. So that is one bucket, but typically if you have private insurance, your outpatient services and the like will likely be covered. If you're covered by FAMUS or Medicaid as a child, then again, you also have most of those mental health services are covered. Most of the even things that private insurance aren't covered are also covered under Medicaid or FAMUS. If you don't have insurance, you may also get help to pay for those through your local Children's Services Act, if particularly at the deeper end of the system, your CPMT, I'm trying to remember, your Children's Office of Children's Services at the local level. And so if it's particularly for kids that need inpatient treatment or residential treatment, those things may get covered through that bucket of money at the CSA. And then for services that are initiated by a school, coming soon, the school will have a chance to also pull down Medicaid reimbursement services for that. So we would like some of these things to be moved into place and integrated with schools, because coming soon, we've unlocked, taken the steps forward that the school systems will be able to reimburse Medicaid. The processes to do that have to be, okayed by the feds and DMAS, but we've taken those steps forward. We think that this summer, those processes will be announced and then provided to schools. So in the coming school year and down the road, there will be another option for school initiated services to get at least a federal match. So there's a complicated ways to pay for mental health services. And our main issue right now is let's at least get some clinicians who are ready to serve kids lined up and accessible to them. Did that make sense?
There has been a question that has come up from time to time about the rural urban divide. And there seems to be the issue that, or the feeling that the urban schools are really good at this behavioral health. And it's just in the rural areas, you know, that we have problems. And I don't tend to believe that to be true. And what's the deal on that?
Wow, that's a really interesting question, and I'd love to talk to folks more about that. My sense is that what we have encountered is that the clinical capacity, particularly to serve kids, and particularly at the CSBs, the community-based public health mental health agencies, really varies from locality to locality. We have some really strong child-focused clinical providers in Region 10, the Charlottesville area one, and the Horizon, which I think is Lynchburg and that area, and Northern Virginia. So there's some spotty, you know, really strong cohorts of clinical providers from the CSBs, and then there's some areas that don't have that are rural and urban. And so I think that you know, we just need to create some kind of consistency and continuum that would be able to serve everyone. And so that comes from some of the workforce issues, comes from and supporting some of those. I think in the chat, I saw somebody mention the workforce issues. One of the things that we're supporting is also a new initiative that would help get freeze. Everyone freeze. Okay, I'm for. Oops. Oh, maybe it's just the chat going on.
No, you're good. You're
okay.
Good.
Oh, now I have a lot of questions. I see. So the one of the I forgot why my train of thought was on the workforce. The one issue that we're supporting that was in the governor's introduced budget is a new pilot program with the Virginia Healthcare Foundation that would help pay for the supervisory time for people who are on the path to clinical licensure in the mental health system, whether they're a counselor or social worker. Right now, those people have to pay out of pocket for their supervisory time, and that can, you know, bog things down, or they can't afford to do that and work, or they may have to make different choices. So this coverage of that, we hope, will get people on that already in the pipeline to a clinical certification, licensure, actually in this case, that they could get there faster. And so that is one bill, a $3 million pilot project in the proposed budget to help cover that clinical licensure time. Let's see. And then I think,
did you see the question on the refundable tax credit?
Yeah, and I also somebody also put in the VMAP program, which we love. Hope maybe you've heard from Sandy Chung and the American Academy of Pediatrics. That idea of integrating health care and mental health has been, I think, just a phenomenal example of why we need to have more mental health in all of the settings, and what we want to see happen in the education space too. So there's a little bit more around on VMAP in the introduced budget. And then the refundable tax credit. I haven't had enough coffee for all of these questions today, but the refundable tax credit means that currently the EITC is the earned income tax credit, and it is offered for low-income families on your federal tax return and on your state tax return. As in the state, we've only received a credit for it, not a refund. If you actually, your balance would then be, you were owed some of that credit back. This would change so that the state would allow families to receive 20% of that credit as a tax refund. So it's, instead of just offsetting your tax burden, it will actually come back to families in terms of a tax refund in the future.
Right. Okay, Deb, that's it. That's all the questions we have. Thank you.
Sure. Yes, Region 10 has been a great advocate as well. So hopefully, I agree, Beth Kaye. Okay, thank you.
Thank you. Emily, thank you so much for your time and expertise this morning and for the advocacy that you do on behalf of children. So thank you. With us, we are honored to have Delegate Watts work us into her busy morning. So thank you and welcome, Delegate Watts.
Thank you. I know many League women voters understand that this is the worst week on the House side as far as trying to get a few bills that are usually the biggest and the most important bills out of committee. And it's been an interesting transition this particular year. But I know I need to be brief for everyone, but let me just follow up on the last two questions that came through. Earned income tax credit. Virginia, again, takes 20%, allows that of the federal earned income tax credit to Virginia taxpayers. There are some states that do all of the federal tax credit, but many states do less than 20%. So the fact that we do 20% is rather substantial amount of credit, and it's based upon working families. It's well administered on the federal side and well targeted. So the issue is whether or not if your taxes due are less than the credit, do you get the refund? As we often get refunds on a lot of other issues. But when it comes to tax credits, the only tax credits in Virginia that are refundable are 4 business tax credits, including the motion picture tax credit. So I would particularly draw everyone's attention who are concerned about the serious equity that's involved in this, because this is well targeted towards low-income working families, low-income working families, that you follow very closely the JLARC study that was launched last year. I carried the resolution of our Virginia income tax structure. It gets into all of these issues because so many things in income tax are circles within circles, and you can't just judge it by, well, other states do this because other states might not do something else. So the equity issues are something that need close scrutiny. I also want to say one comment about the question about that, oh, well, the problem of mental health delivery of services, and I'm going to stay with K through 12, is taken care of in urban areas, and it's only the rural areas. I just absolutely don't see that in the years and years and years that I have been involved in this. It is true that urban areas are going to have more licensed professionals because they tend to locate where they have a collegial community of in the field. That is true. And it is also true that urban areas in Northern Virginia pay significantly more in local funds into mental health at all levels. But what is lost in that last one is that just to be even, we have to spend more than 1/3 more because of the high cost of living. And that gets lost in the dollar figures that we're only even if we pay 130% of what is being paid elsewhere in the state. And I'm actually underestimating the 130, it's more like 135. Where I see 2 things to be considered in all of this is, one, at least as far as our particularly Fairfax County has 1.1 million people, but the larger counties in particular, they have much larger class sizes than what you're going to see in elsewhere in the state, significantly more. And that includes urban and rural, where my two granddaughters who just moved down to Virginia Beach and 4th grade have classes of 19 and of 20. Whereas in Northern Virginia, it was 28, 30, 32 in the 4th grade. That does make a difference in a child's mental health as far as whether or not the adult in the room has relationships with the child and is able to spot in a preventative way something that may need to be addressed. However, I will also say that on the rural side, the lack of economic opportunity, and we have seen this tragically in national report after national report, if you're not familiar with it on Virginia's basis, the opioid and fentanyl abuse going back 15 years. It started specifically in the Appalachia area, is a serious, serious problem. And one of the reasons why it's a serious mental health problem, and I do put the two things together, is that those who have no economic future are much more apt to escape through substance abuse and or just have not dealt with in a hopeful way how they grow and develop throughout their entire lives, which just exacerbate issues of depression and other issues that are dealing with mental health. So yes, there's a disparity, but it's, again, like so many things, there's our layers upon layers, and the disparity does not always lead to better mental health by any means for the individuals. Which brings me to what I was going to be talking about this morning, and that is the workforce, the workforce, the workforce in all of these areas. Some of you are aware, I've been working on nursing home standards, staffing standards for 20 years, 2 decades. As I said last night in hearing, when I started out, I was advocating on behalf of my parents, my aunt, my sister. Now I'm advocating on behalf of my contemporaries. And we are building a coalition. I'm a little dismayed. I'm just impatient about this. After 2 decades, I'm downright impatient. We are building a coalition that will be essential, and it won't be unlike what finally brought Medicaid expansion, where we realize that adults in poverty need the assistance of Medicaid. Well, when it comes to the nursing homes, they're in a nursing home. And we have just forgotten that they are the same people we were so concerned about in Medicaid expansion. And because Virginia, a number of years ago, in carrying out aging in place, raised the standards considerably to be able to go into a nursing home under Medicaid, you cannot perform at least 2 of the 5 measures of daily living. Feed yourself, get up, go bathroom. You need more assistance if we don't have nursing standards. We lost more people than the average state in COVID, in nursing homes, than in our general population. I thought this would be the year. And the coalition now that is active is AARP, Virginia Poverty Law Center, SEIU, retired teachers, the Aging Network, particularly NVAN coming out of Northern Virginia. That coalition has to grow. These are people that we have cared about until they age out. And they're alive, they're real people laying there. They are, in fact, my contemporaries laying there. I'm lucky enough. I have long-term care insurance. Hopefully all of our savings, and I do underscore all of our savings, will get Dave and I through what we need. And those nursing homes will have the benefit of that additional income But when the average number of people in nursing homes, 60% are on Medicaid, you can be sure that the nursing homes that I'm talking about that I will end up in will have those additional resources coming out of my private pay capability. The nursing homes, the average is 60. So we're talking about nursing homes with 70, 80, 90% Medicaid patients do not have that residual of any additional support. So while we have put in a carrot approach, there's no question, I've been an advocate for the nursing home needs. There's no question that we're underfunded across the board in the public support. But we've put in value-based purchasing, which is a carrot approach that says to the nursing homes, if you do this, this is the level of support. If you do this, you get more. If you do this, you get more. That's a carrot approach to better quality care at the higher end. But we are not addressing the Medicaid end, which has to be addressed through staffing standards and funding those staffing standards. Unfortunately, this got killed rather summarily in the Senate, even though there had been a full year of study from the Health Commission endorsing what we needed to do, endorsing what I have been saying for 20 years. I'm saying, yes, finally. On the House side last night, hopefully this stays alive in that it was carried over with a, I believe, very sincere commitment on the part of Delegate Orrock, who has chaired and is chairing again health, welfare, and institutions for many, many years. And he is committed, as we stared together, that this next year there will be a serious work group to see how to work out all of the ways in administering staffing standards. So those are our three quick things. I will bring it back full circle to taxes. As I said, and this is straight line out of when I was League of Women Voters president testifying on the local budget, that when I look at my personal budget and my priorities, and I'm speaking as a young wife and house mother and all those things that our role was, what I'm speaking about tonight has my priority in spending. I'm speaking about things that, yes, will take tax revenue. And that's where we are today on the state level as well. What are your priorities? Is it really more important to have the additional $300 for your personal spending versus being able to address some of these needs? And we cannot address them without funding so that we have a living wage for all of the employees that we expect to deliver, as well as attracting people into these critical service needs in direct care and mental health. So there we are. Questions?
No, there's just a lot of really good comments about thank you. And but Ann Murphy says budgets are moral documents, and that's a very interesting comment. So a lot of very good comments and thank yous to you and your work.
I just have one question. What are the main points of resistance among delegates?
What are the main points of
resistance to the standards of quality of care?
Can you repeat that, please? We couldn't hear her.
The question was, what are the main resistance among the delegates to the quality of care? Cost is number one. There was an interesting fiscal impact statement interpretation of what the bill was that came out of the Health Commission that I was carrying, that's HB 330, that they interpreted it at the highest level. Would that we were there. Basically 3.9 hours of direct care per day. That price tag is huge, but it's aspirational. It says this is where we should be. So, but even at a beginning phase in, we are looking at least 20 million. It should be more in the neighborhood of approaching $30 million of state funds to be matched by federal funds. Now, in today's budget, with all of the surplus, et cetera, that we have, and the willingness to say, oh, we can do away with certain tax sources permanently now and forevermore because we've got a current surplus. That $25–30 million is really, somebody said, anyway, pales in comparison to some of the big numbers that are being talked about. Thank you.
Thank you so much, Delegate Watts, for your years of work and hopefully a win in the end. And I can personally attest that my husband recently retired for health reasons, and it is a daily ordeal trying to navigate the care, the insurance, and what are we going to do in the future. So I think a lot of us are going to find ourselves in that position. And so thank you for working on that. Really appreciate it.
Thank you for your assistance.
Our next speaker is Dora Muhammad. Dora is a great friend of the League. She is the Congregation Engagement Director for Virginia Interfaith Center for Public Policy. And I know that is not the only hat that Dora wears. Dora, thank you so much and welcome.
Thank you. Thank you, Deb. And absolutely. So I'm also the Health Equity Program Manager. And I believe this year we're going to change that to be Health and Racial Equity Program Manager. So it just keeps expanding. But thank you for the invitation. Thank you for the introduction. Absolutely love working with the League across the Commonwealth. One of our biggest champions for you all within the center is Ann Murphy. She is our Northern Virginia chapter leader. And so anything that you all are doing, she keeps us abreast of. And specifically for the purpose of the roundtable, I'm very, very thankful for the support that Deb has given on behalf of the League of Women Voters, part of our Push Maternal Health Coalition. Absolutely could not do this work without allies and partners like you all. So for us, beautiful theme this week, protecting our children. We have one bill that I'll focus on. Joan told me, so you understand how I'm phrasing my remarks, to talk about the good, the bad, and the ugly, and how can you all help? And so that is literally the categories that I've done. And I'm going to begin with the ugly so we can end with the good. So we have one bill, that I've been championing. If you've heard me speak at all during the session, it is our implicit bias training bill. There are two identical bills. In the House, it's HB 1105. In the Senate, it's SB 456. It's being carried by Senator Locke in the Senate and Delegate McQuinn in the House. And so it went up in subcommittee first on the Senate side, and it was in subcommittee in the House this week. So I will talk about that, the good and bad and ugly with all of that, but a little bit about the bill. And before I do, I'm going to drop in some links and information Joan had asked. So there is a fact sheet. You scroll down on our policy page, you can grab that. I'm also putting in my email address and telephone number, and then a little action that I'll ask you all to help me with. So the bill basically emerges out of our maternal health campaign in 2019 that emerged really nationally in response to the US's maternal mortality crisis that has Black women dying on the national level 2 to 3 times more than their counterparts. In Virginia, it's higher, it's 3 to 4 times more. And so my bill, we drafted it, it goes into the code and it amends the code where the General Assembly had dealt with the opioid crisis in 2016. Part of one of the interventions that they implemented was having 2 hours of continuing education around opioid
Recording in progress.
And so that's what this bill would do. It would require 2 hours of continuing education on implicit bias training for all healthcare professionals licensed by the Virginia Board of Medicine that have direct contact with patients. That was one of the amendments that we put in, we tried to put in the past couple of weeks. And so it emerges from really the state of California at a time, and we don't have it yet on our website, but there is a graphic that we had wanted to present this week in the House. At this time when across the country, all states, their maternal mortality for Black women were rising, California was the only state that had a sharp decrease. It dropped by 55%, very significant drop. So all eyes turned to California to see sort of what are they doing? How can we replicate that here? And so California had did a 100% overhaul of their clinical processes. They did clinical administrative interventions. And so as they looked closer to the data though, they saw that even though the total number of women was decreasing, the actual racial disparity held the exact same. Even though it was less women dying, Black women still were the majority people who were dying. And so they then implemented an implicit bias training. And that was when they began to first see the decrease and the decline in the actual disparity. And so since then, that was in 2010, other states in 2019 began to hold on to that and implement and include implicit bias training in all of the interventions that they're seeking to do to eliminate preventable pregnancy deaths. And so that is why this bill centers on that. It really is sort of one of the things that was not included in Virginia's maternal mortality review team's report and recommendations that they did in 2019. They found that 51% of all pregnancy-associated deaths correlated with a provider-related factor. And those were delay or lack of treatment, diagnosis, follow-up, referral, or consultation. And so all of those who were in healthcare understood that to be correlated to implicit bias in the healthcare settings and the assumption studies that's linked to that. The main one being that Black women have a higher threshold for pain. And so if I'm presenting as a pregnant woman in the emergency room and you think that I have a higher threshold for pain, you will have me waiting longer. You will have me, you would require less attention to me and you won't really fully consider the pain that I'm telling you. And that has resulted in maternal death as well as infant mortality. And so this bill really stems to really focus in on that and really address that. And so we have had the ugly of that. And so there's a link to the fact sheet with that. The ugly part is we did have some severe opposition to the bill, which was unexpected. And it was more so unexpected, the type of tactics that was used. Very early on, we were approached on the Senate side with our Senate patron and her staff being pressured by the Medical Society to do a substitute bill that really would kill the bill. It really was seeking the agenda of some of the doctors that were members of the Board of Medicine, not the full Board of Medicine. It was not their decision to oppose my bill, but there were some doctors who really were advocating that the Board of Medicine get the authority, that the legislative authority to enact continuing education requirements be moved from the General Assembly to authority given to the Board of Medicine. And so they had a substitute bill and they were pressuring and intimidating Senator Locke in her office to substitute the bill and basically say, if you didn't, we would oppose it. And it was very skewed, it was very deceptive, and it was not really representative of what the Board of Medicine had decided in June. So we immediately went on the offense with that and really corrected the narrative with legislators on the Senate side. But it was very disheartening because then when it honestly came to the House side, we did not really get the same response that Senator Locke and her staff gave me. And so on behalf of the coalition, we were very, very disturbed. Initially, Senator Locke said, well, read the bill and you tell me what you want to do. Because again, we drafted the bill and she gave me understanding. I say this all the time. I'm a short woman. I'm under 5 feet. So people tend to underestimate me. But generally in this space, in this session, we have a powerful coalition that the League of Women Voters is a part of, about 20 organizations statewide, that I go into these spaces knowing that this is who I'm representing. I'm representing the women who have had miscarriages, whose family members have died. I have a family member who had 2 miscarriages last year. So this is very personal for me, but it's also very expansive. When I say I, it is really we that I'm speaking of. And so when Joan asked me, how can you all help? I really do need your help because what has happened this week to the really dismay of many of the coalition members. My phone literally was blowing up all Monday night while we were preparing to present the bill yesterday morning in subcommittee on the House side. And I will say this, we have had strong bipartisan support on the House side. However, the main sort of, if you will, agent of the opposition met with Delegate McQuinn Monday night. And so we were not told about the meeting. We have since been trying to get information about what was discussed in the meeting. I tried to do it Monday night, and I haven't received it yet. Kim, our executive director, has requested a meeting yesterday, try to get in and have that meeting. It did not happen. And now 2 days later, we still do not know what was discussed in that meeting. And I will tell you this, everything that the rep agent that they are speaking with from DHP is not aligned with any of the stakeholders that want to see this measure passed. They want to sunset the training, and all the stakeholders in OBGYN, the nurse midwives are supporting, saying this is something that has to be ongoing. This training has to become a part of sort of the comprehensive work that's done, that's continuing. And so I do ask, that's why I put the email address and the telephone number for Delegate McQuinn's office, because I just find that perhaps my little person is being obscured and minimalized, but the coalition cannot be marginalized. We cannot marginalize the voices of advocates in this space. And so I really truly want you all to reach out to Delegate McQuinn's office via email or telephone and tell them and urge them that they need to disclose what was discussed in the meeting Monday, because the advocates were not given public comment. I was told you do not need to show up in the committee meeting. Public comment will not be taken. And this really, really upset many of the coalition members who were prepared to speak. And it's absolutely, it's just not how advocacy and policy change and work should be done at the General Assembly. And so that is how I need your help. Today, if you will do that, I would definitely appreciate it. But I will move on to the bad. Okay, so here's the bad. And it starts with the good, because like I said, again, we do have strong bipartisan support. One of the advocates from the American Cancer Society told me, well, Dora, hold your head up. At least your bill was continued. You know, everything else has been dead, DOA, dead on arrival. So that's what really where these two bills stands. There's really in this session, there's no more sort of legislative work that needs to be done. What the Senate subcommittee did, and I will go through really sort of how that conversation emerged, because it's telling. There's some really critical things that happened. But both the House Delegate Head, who's the chief co-patron, along with Delegate McQuinn, put a motion yesterday to follow what the Senate did in subcommittee 2 weeks ago, and it was to continue the bill. So it's not dead, it's going to be continued to 2023, which as Senator Locke's aide told me, like, you're in, like that means you're automatically already in our stack for 2023 for our bills, which is good. And so it emerged in the Senate from a discussion. Here's the sequence that will help you why it's bad, but it's not good. It's bad because there are truly some Republicans who truly want to have bipartisan work this session and are trying really, really hard to get it done, but they do have challenges and they do have people undercutting them. And so specifically, Delegate Head is an absolute champion for this bill. Personally, he knew about it before I presented the bill to him. He knew about the issue, and he's been trying to whip support for it. He spoke very eloquently in the subcommittee meeting yesterday in Health, Welfare, and Institutions, Subcommittee 3. I believe we've clipped it and put it on our YouTube channel, and it'll be in our newsletter. But then on the Senate side, again, because we knew because of House majority shifting, a lot of our focus honestly was meeting with delegates to really try to whip support on the House floor. We really hadn't paid too much attention to the Senate, but what they did with Delegate Head, they added it was initially 5 members on the subcommittee. With him and the 2 other Democrats, we were assured that it would come out of subcommittee. Well, Monday, they added a 4th Republican to the committee. And so it automatically undercut sort of the automatic arch of it getting out of subcommittee. And we didn't have enough time to do any lobbying with the new delegate that was assigned to the subcommittee. So they voted on the party line against truly getting it out. And so we knew that we wouldn't have the votes. And so they voted then to just put it into the continuation like the Senate would. The part, again, that was distressing was the lack of public comment. In the Senate subcommittee, there was immediate harsh kind of opposition from Senator Donovan, who is an OBGYN. She practically dismissed that there was a maternal health crisis. She took it honestly very personally because she's an OBGYN. And she initially put in a motion, pass it by indefinitely. And when she said indefinitely, literally you could hear like the record scratch, silent drop. Everybody looked at her like, what? Did she just happen? What happened? No, we're not doing that. And so Senator Barker then threw out the measure that was passed in 2021. There was a task force that was set up. And I've been calling what he's done as a lifeline. He recommended that we work on strengthening the language of the bill with the task force. It's called the Maternal Health Data and Quality Measures Task Force. He is a member of that task force. There's some community members that were appointed, as well as several other delegates. And the staff liaison is the health commissioner, Dr. Oliver. And so when he mentioned that, then the senior Republican, and this is the point I want to we're going to try to have some district meetings around it. And then onto the good, because again, we want to make sure that the work group, however it's established, I am going to have a follow-up meeting with Senator Barker's aide, Dave, to really drill down the timeline for the work group. This is pretty much post-session, but we want to be prepared. We definitely want to make sure that advocates are not marginalized in the process with the selection of the members, the actual composition of the members. Just want to get a clear idea of what our role can and should be, and so that we are properly positioned to make sure that that work group is transparent, that it's effective, and that it aligns with what the stakeholders want. To that effect, here's the good. Our coalition continues to grow. There was a horrible story this past weekend. There was a professor of sociology at UVA who presented at the emergency room. He couldn't breathe. He couldn't breathe. His name is Brian Foster. And from the ambulance to the emergency room to every healthcare professional that interacted with him focused on the fact that he had ate an edible probably like 2 or 3 hours ago. So they was constantly trying to ask him questions about his drug use, like something new. And it was not about actually any of the symptoms he was experiencing. He was trying to explain to them, what he had eaten and what, when he couldn't breathe, all these things, but everything kept getting centered back as soon as someone would enter the room about his drug use, and the assumption that he was a druggie. So this blew up on Twitter over the weekend. And UVA has been trying to do severe damage control over it. Well, someone sent this, absolutely. Someone sent this story to us, was like, hey, can this help y'all in y'all implicit bias campaign? And we were like, absolutely. And so I reached out, Kim reached out, our comms director reached out to him. I had to pull it up on my phone. And we connected with him. It's frozen up. Okay. And he has told us that he is in this with us for the long haul to do whatever we can, because he definitely experienced what implicit bias, how life and death threatening it can be in a healthcare setting. And we have gotten his support. And so we hope to integrate him in some of our work. And so definitely, again, know that moving forward, we look forward to continue to working with you all and creating these spaces for our voices to be heard on these issues, because I refuse to let us as advocates be invisible and voiceless in this space. So with that, are there any questions?
We're running over a bit, but we do have one quick question about what did Senator Donovan deny?
Oh, she said it was several things. So the first thing, she was saying how there's really isn't a need for the government to get involved. She said that this is something she's worked in OBGYN as an OBGYN she's dedicated her career. I want to say maybe she said 40 years. It might have just been me listening. I was far away. But so that was the first thing. She felt like there was no crisis. This was too much, basically. It didn't demand a legal measure from the government to get involved. Because during my comments, I had equated it to the opioid crisis and the fact that Black women and babies are dying now. And this needs a response now. And so that was her countering that there's no urgency around this. The second thing that she really denied was really the need for us to look at the training. And honestly, actually, Senator Hashmi at the time, she was the chief co-patron, was the one who was presenting the bill in Senate subcommittee. She really corrected her. But Senator Donovan had said, well, you know, I have, for my license, I have to go through implicit bias training that's very effective. Like, so what we have is working here in Virginia. And Senator Hashmi said, well, if what you all, she said, I think you all need to look again at what you all are doing, because if what you all doing really was working, we wouldn't have the disparities that we have. And it was like a mic drop moment. So those are the two kind of main things that she kind of disavowed, if you will. There were other things, again, but those are the two main things. There's one that actually is minute that can be just corrected with information. She felt like because she does the training, she didn't need another training, but that's not how the Board of Medicine works. If you do have a training that's a qualification for a certain license, they do accept that. So it's not like she would have to do 2 trainings, but God forbid you had to do 2. Okay, but you know, so that's kind of minor.
Thank you. Deb, we have no more questions.
Wonderful, thank you.
Dora, thank you so much. I know that David Smith with Delegate Kory's office has been waiting patiently, and Delegate Rasoul just walked in. And so I just want to give him the opportunity to say hi. Sorry about the feedback. Let me just say hi and I'll just say hi.
Hello, everyone. Great to see this awesome team together, strong. We're virtual this year, but again, I see 72 participants. Usually you all are marching through POCA, but now you're this virtual threat in all of these committees, letting people know, including my education committee that I was in today. We appreciate you all helping to ensure that we protect our public education funding, which is critically important. I will say we've got a newer chapter out in Roanoke, and we've appreciated seeing the league all across the Commonwealth. A great group of people who have stood there, especially on education, but beyond that, we know all the wonderful work you've done around protecting our access to the ballot box and a lot of the voting rights work for sure. We are doing our best to play as much defense as we can. That means making sure that we even build bridges, try to find some common ground with my Republican colleagues and others, so that way some of these critical issues are not always hyper politicized. Some of that doesn't make the headlines because you usually hear about just when we're going at each other, but we are trying our best, even in the minority in the House, to see if we can find ways to slow the roll on some potentially damaging legislation, and then of course support our colleagues in the Senate to see what they can to stop. Let this be a stern reminder that we went from the trifecta and being able to control the House, Senate, and the governorship to very quickly, really in some ways, holding on by one vote. And to me, it's a stern reminder that we should never take anything for granted. I hope that we'll utilize this opportunity as a lesson learned, because I believe that we need to make sure we're listening to everyone in the Commonwealth, and that it's going to mean working with people from all across and ensuring that we are, in fact, building those beautiful bridges, and Republicans and Democrats can come together, as I know we have many persuasions here, to ensure that we're working for what's best for the people. So I appreciate all that you all do and in helping us. And of course, I'm always here for you. I can ever be of any assistance. Thank you. Thank you. I appreciate it. And I don't know if you all are taking questions, but if not, thank you so much for having me today. virtually, and hopefully we'll get to see some of you all safely in person in the near future.
Thank you so much, Delegate Rasoul. We appreciate your coming in and we appreciate your advocacy. So thank you so much.
My pleasure, my pleasure. Thank you. Have a wonderful day.
So thank you. Things are always happening over here.
Oh.
And David, thank you so much for joining us today in Delegate Kory's place. We're sorry that she could not join us, but thank you for your patience as we shuffle in speakers, and so happy to have you. Please, welcome.
Oh, I'm sorry about that. My other computer froze up there for a second. Is it my turn to go?
Yeah, you're good. We can hear you.
Wonderful, thank you. I am Delegate Kory for this session.
Sounds familiar.
Sorry
Yeah,
about.
there's something with your sound, David.
Why is that doing that?
You're feeding back on yourself.
I don't know why that's happening. We're just going to totally shut down the other computer here. All right. Are we doing better now? Yes.
Much better.
All right. Sorry about that delay there. So yeah, first of all, the Delegate Kory sends her apology. She's sorry she couldn't make it this morning, but she's so thankful for the work that you all in the League of Women Voters are doing. It's great to see folks out there activated, be advocates for the positive change we need to see in Virginia. So she asked me to speak about a couple of the child safety issues that we have going on in Virginia right now. First of all, of course, the biggest concern, especially with her time as a school board member up there in Fairfax, is all about the masks, making sure that our children are protected in schools. We're really concerned about what's been coming out of the governor's office and really trying to roll back some of the safety requirements in our local public schools. So we're doing what we can to make sure that our children stay safe in our schools from COVID, and making sure those masks are there to protect the children, the teachers, and those extended families. She also had a couple really interesting bills this year, really new policy for the new. They didn't make it out of committee, but I was saying that it's new policy in Virginia, and as you all know, policy sometimes takes a while to make its way through in Virginia. So one of those bills was
I'm sorry, David, it's going strange again.
There's white squares and there are gray squares. Put your bottom on a gray
There's
square.
a lot of noise from somebody else's
Going out on a gray square.
feed right now too.
No, I'm furiously muting people.
Okay.
You're good. Thank you.
All right. So yeah, one of those, the first bill I want to talk about was HB 686. This is a bill that the first time was ever introduced in Virginia. It's been introduced in Missouri and also was being proposed in Pennsylvania. This is a bill that if somebody's guardian, if a child's guardian, parent, guardian, whoever has custody of that child is killed by a drunk driver, then they are able to pursue child support from that person that's convicted of that felony drunk driving. So that way they're able to support that child through that child support from the drunk driver. So we think it's a great idea. We think it gives a level of security and safety for those families who suffer this horrible loss, this tragic loss of the death of a parent or guardian because of a drunk driver. I was saying it didn't get out of subcommittee this year, but it's new policy. We hope to make some progress with it moving forward. Another one, once again, this was brand new policy. We couldn't find any other state that has really taken this step. It was looking at school board boundaries and equity in access to advanced programs. So school boards have a lot of power, right? They're able to draw those boundaries and direct kids to certain schools. And there are competing interests going on there. On one hand, a lot of folks want to be at a school close to their home, right? because it makes life a lot easier. You have that community going on there. However, we know that especially in urban areas where you have a lot of different schools, then the way they draw those lines can really affect equity and access to advanced programs, or equity and access to those specialty classes. So they might be available at one of the more suburban schools, but not necessarily at one of those more urban inner city schools. So her bill would have required that any redistricting that happens in Virginia would ensure that you at least have the same amount of access, if not a greater amount of access, to those specialty programs, to those advanced programs. So it didn't get out of committee this year. There was definitely some bipartisan interest in it, but once again, it's a new policy for the state. It's a new idea. So people want to find out more about it. Some delegates already approached her on the Republican side, as well as say, hey, let's talk about this. Let's see if we can find a way to make this happen next year. So we're really excited about that as well. Once again, looking forward, seeing all these issues that can really help our kids, provide a safer environment for them, and give them that chance to succeed in life. Now, I saw a couple questions pop up. I'm on my cell phone right now, so I'm not sure what they were, if there are any questions.
Yeah, the one question about the drunk driving bill, how many drunk drivers have sufficient assets? Is there some kind of study on that?
I don't know if there has been a study on that. However, I do know just from personal experience, folks that I have met that have had issues with drunk driving, a lot of them do come from professional classes. So you have your lawyers, your doctors that are struggling with alcoholism, unfortunately. So you do definitely have folks that have that level of income that would be able to provide support if a horrible event like this happens.
Yeah, there were a few comments about our positions, but no other direct questions that I'm seeing in chat. Deb?
Okay. Well, David, thank you so much, and give Delegate Kory our regards. Thank you, everyone, for joining us this morning. If you have questions, you could reach out directly to our speakers, or please send them to Joan or me and we can pass them along. Watch out for our action alerts. We're sort of doing a hybrid between Outreach Circle and MailChimp, but I found some of the MailChimp action alerts in my spam folder. So check your spam folder and make sure that you're getting all of our action alerts. Thank you so much and have a great day.
Oh, and Carolyn Kaye would yell at me if we didn't remind you to push the 3 dots. If you want to save the chat, go down to the bottom and push the 3 dots, and then you can save the chat. She wanted to make sure. Yes, Carolyn, for you, anything.
Kudos to you.